explore. And when I go on into deep, it is really a wonderful test. So he is asked to elaborate why this test is important and why we should adopt in our day-to-day practice. There are very interested people, I would say, sitting in the audience. So, how many of you are doing a pap smear routinely? We all know about pap smear, right? And how many times you detected cervical cancer via that test? Do you remember? Occasionally. So it is very rare, very occasionally that pap test can detect the cervical cancer. So that's why the concept of this DNA ploidy test to diagnose the cervical cancer more effectively came into the picture. We know that India reports death of women due to cervical cancer every 7th minute. So by the time I finish this talk, maybe 2 women die in India because of the cervical cancer. So this is the highest burden of all over the world. India is one of the major chunk that woman dies because of the cervical cancer. Cervical screening and cervical cancer in India. Global, we have 20% new cases and 25% deaths worldwide. And 5-year survival rate is only 46%. So this is the effect of that deadly cancer. Most of the cervical cancer are squamous cell carcinoma, 90%, and develop from the ectocervical cells. Other part is a adenocarcinoma, also known as a endocervical adenocarcinoma, and it starts at the glandular cells. So nowadays previously we termed as a CIN1 and CIN2, but now we termed as a low intensity cervical intraepithelial neoplasia or lesion, and then it's SIN, that is high grade cervical intraepithelial lesions, and lastly it will turn into the cervical cancer. And this is the way of progress from normal to the invasive carcinoma of the cervix. And cervical cancer is a rare outcome of very common infection. Just our previous speaker has described that the HPV infection. But not all HPV infection turn into the CS cervix. Very few of the HPV infection will turn into the carcinoma. There are more than 150 HPV types, and high risk types among them is mainly 16 and 18, and other type usually turn into the common warts, and these are non-cancerous things. Now prevention and early detection is the cornerstone of the cervical cancer management. So why the screen and treat approach for an early detection for cervical cancer will remain critical in India. If we look at this table, you can see that the main reproductive age group 15 to 64 years has almost 44 crore women into that age group. So practically it is not possible to screen or vaccinate all these 44 crore women in India. So that's why we have to think that how we can manage. Now we come into the screening part. How we can detect the cervical cancer? We know age old, we have just discussed. It was pap smear, invented in 1949, so almost 125 years of picture. And in 2000, HPV came into the picture, HPV testing. But this test given us clear-cut sensitivity and specificity. So now we have this DNA ploidy test or genetic testing, or I would say it is three traditional methodology to find out the cervical cancer. One is just the visual inspection. Second is all we know is a PEP test and liquid-based cytology, and third is the HPV. Up till now, what we do. So in visual inspection, we can see only morphological changes, what we severe dysplasia. And HPV, we can detect high risk or low risk HPV only. It is not predicting the cervical cancer. So, what is DNA ploidy test? It measures the amount of DNA in every cell nuclei to detect the abnormality. It is said that gain of chromosome 3 defines the transition from the severe dysplasia to the invasive carcinoma of the cervix. In a simple word, if I explain this DNA ploidy test, it is the quantity of the DNA into the cell nuclei that is measured by the AI. So this is this DNA ploidy test. So this is the picture of the normal pap smear test, and on left side is the DNA ploidy report. In a PrEP test, we can see the morphological structure, and it requires a lot of expertise, and it is a subjective, individual pathologies to pathologies variation. But DNA ploidy test, when you make a slide, it will go into the large database of the artificial intelligence system, and they analyze the all cells. They give report of 3,000 cell analysis minimum. If they found less than 3,000 cell analysis, then they will say that this is not the adequate sample, please give us the next sample. And then all this image-based cytometry, they find out the nuclear content of each and every cell. And which cell has an abnormal nuclear content, they will find it out and give as a report. If you observe this report, do I have a pointer? If you observe this report, you can see the numbers written here. Some of the numbers are green and some of the numbers are in orange. So green are the ideal, the nuclear quantity of the cell. Orange is the little bit increased nuclear quantity of the cell. It is defined as a less than 2.5 and more than 2.5. If you see the next report, this is the abnormal pap smear report. Hardly we can detect anything here as a gynecologist, but expert pathologists can define this. But if you see abnormal DNA ploidy report, you can see all the red color here. Red color is more than 2.5 nuclear content of the cells. So it is clear cut defined all these cells as the abnormal DNA content. So ploidy test, it was actually developed by the second. And number of chromosomes were lost or gained. It affected the DNA quantity within the cell. It can happen due to many factors. So this is the basic genetics of the cancer. And in servicior or DNA ploidy test, it can detect the aneuploidy in a squamous epithelial cell. You can say when abnormal cells are found, it is going to be cancer or it is cancer. But in DNA ploidy cell, it detects earlier, quite earlier than 2 years or more than that time. So DNA ploidy test has a very high accuracy. It is a sensitivity claimed is a 98% and specificity claimed almost 100%. So this is a kind of a new landmark into the diagnosis of the cervical cancer. Aneuploidy is a proven biomarker for cancer for more than 100 years. It has the highest accuracy molecular diagnosis, quantitative results, it is invasive, it is cost effective, it causes early detection, and ultimately it saves the lives of the woman. And this technology is uh, developed by the Canadian Center and approved by the USA and European countries as well. The sample collection, how we collect the sample, it is almost same as we collect the sample as a pap test or liquid based cytology. They provide the kit and we have to collect the sample and give that sample to the laboratory, and they process the sample under the AI microscope and give the result. So this is how the result came, and only one abnormal cell has a significance. If you find only one genetically abnormal routine screening, 1 to 2 cells are detected, then you have to repeat the DNA ploidy test after 3 to 6 months, and 5 to 10% of the cells are proliferating, then you have to repeat ploidy test 3 to 6 months. I would surely says I have done quite a few number of cases in our center also, and we have